Courtney Madden here at Memorial Hermann for our weekly Doc Talk with physical therapist Talal Hariri. We've talked about knees, we've talked about shoulders, we've talked about elbows. Talk a little bit about ankle issues.
The most common injury is a lateral ankle sprain, and a lot of people suffer from these, and they're painful, but they can recover pretty well if you manage them right. There are three main ligaments on the outside of the ankle that can rupture. The most common one is the one on the front called the ATFL, the anterior talofibular ligament. And initially, once you sprain the ligament, you want to ice it down, elevate your foot, put compression on it, and stay off of it for a few days. But it's important to keep it moving because you don't want it to stiffen up. And so that's what we'll do initially after the athlete comes off the field, or if they have some sort of pain. We're going to check out their ligaments, find out where it hurts, and then start them on that kind of program.
What's the longest rehab program that you have for ankle injuries?
Well, each one obviously can be a little bit different depending if it's a grade 1, grade 2, or grade 3. So grade 1 is kind of just like a stretch of the ligaments. Grade 2 is a partial tear, and then a grade 3 is actually rupturing it completely. So they can vary based on the severity of the injury. So it can take anywhere for a ligament to heal. It takes anywhere between 10 to 12 weeks. So a bone fracture actually takes a little bit less time, 6 to 8 weeks usually. So an ankle injury or a ligament injury, you're going to assume 10 to 12 weeks minimum.
How would a parent know when to go ahead and go to the doctor?
If they can't walk off the field, then we're thinking fracture right away, and we suggest going to the ER and getting an x-ray. If they can walk off the field and put a little bit of pressure, then we're thinking more of a ligament type injury, so a sprain. If they have severe swelling and it's starting to turn purple and discolor, then I would suggest going to see your doctor, getting an x-ray or MRI just to check it out. The problem after an ankle sprain is people tend to get them frequently after that. And the problem, or the reason why, is because the ligaments get stretched out, and then it takes your ankle a little bit further to roll before you feel that it's about to give out and cause an injury. So one of the major things that people overlook is balance training and standing on one leg or on wobble boards or whatever, standing on a pillow and tossing a ball with somebody, just working that ankle so you know where your body is in space. And that's one of the biggest key factors that we could tell our athletes to prevent further ankle injuries.